Hello and welcome to the 2020 Brain and Transcranial Photobiomodulation Virtual Summit. I'm your host, Dr. Joe Doduro, and my guests today are Thomas Feiner, who you met at a previous meeting, and Penny Jean Gracefire. She's a neurofrequency analyst and published author who rides motorcycles, drinks tea, and designs therapeutic interventions using 3D brain imaging technology. She's a licensed mental health clinician, and she integrates emotional experience with electrophysiology to alter neural dynamics in real time. This helps people recover from trauma and improve brain flexibility and resiliency. Her groundbreaking work has led to industry-wide changes in neurotherapy, and she has, is the basis of current international certification. She's actually won the American Mental Health Consulting Association's President's Award for her work as co-chair of the Neuroscience Task Force. So she's going to talk about in a minute. Thank you for coming on board, you guys.
Happy to be here.
Thomas?
Happy to be here as well.
So what is the task force do? Is a SWAT team, a brain SWAT? What do you guys do? You ride in on your motorcycles and fix people's brains? What?
Sure. So currently the American Mental Health Counseling Association is working to put together some content and materials for a certification course for mental health counselors. And the point of it is to essentially bring them up to date on current neuroscience that's relevant to mental health counseling so that mental health counseling has some standardized education for neuroscience-informed therapy.
I like that. We hear that a lot, that the psychologists are taking care of people but they don't know anything about the brain. I mean, they don't know how it's working. They don't really, they don't have a physical map or an entity that they're taking care of. And it seems like the education, when the lights goes on, people get excited about that, psychologists and psychiatrists. Is that what we're talking about?
Yes, it is.
Excellent. Can you tell me, from your background, how does a tea-drinking motorcycle mama, if you will, get involved with transcranial photobiomodulation? What's the progress? Boom, 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 boom. Can you tell me about that, your background?
So I've been doing I'm a licensed mental health clinician, and when I was in graduate school, I did an internship at a practice that was just incorporating neurofeedback. So I've been doing neurofeedback for about 15 years, and probably photobiomodulation for 3 or 4 years now, approximately. But one of the things I really enjoy doing is integrating modalities. And so I'm always looking to combine things to see if we can get enhanced effects. And so a few years ago, I designed some, obviously with the help of some of the people I've been working with, which I'll talk a little bit about when I get to my talk. But the point was to design some EEG modulated photobiomodulation, because photobiomodulation by itself is really quite effective. But I was wondering if I could team it up with neurofeedback and actually make the photobiomodulation a feedback element instead of just a feed forward. Would that be more effective for certain things? And so that's what I've been working on the last couple of years.
Whoa, just a couple of years. Okay, well, I'm excited. Do you want to add anything, Thomas, about our guest, our mutual guest? Do you want to say anything down there?
I know Penny Jean since, oh my God, about 10 years now.
So long.
It was always a pleasure listening to her and seeing her development in the field. She was always way ahead of everybody, and she's a great person, and I really enjoy working with her a lot. And I was happy when I asked her, will she contribute to the summit, and she said yes. And wow.
Yes, me too. So, anything else you want to integrate before we talk about your slides, then, dear? Are we good?
I think Thomas was going to go first and talk about his clinical case, and then I was going to slide right behind him.
Okay, then go ahead, Thomas.
Yeah.
Look forward to it.
So,
all right, This is a case study of home training photobiomodulation, so at-home care. So thank you, Thomas. Go ahead.
All right. Okay. So this was about a hemorrhagic stroke, and I want to tell a little bit about the hemorrhagic stroke and the stroke strokes in general. And because that was a really heavy hemorrhagic stroke we treated, and to understand what that means, I would like to bring some information in here. So we actually have two kinds of strokes. The one is hemorrhagic stroke and the other one is the ischemic stroke. Both can do a lot of damage to the brain, and there are also two ways there is an intracerebral hemorrhage and a subarachnoid hemorrhage. We had an intracerebral hemorrhage here, and it comes from an increased intracerebral pressure, and people usually have headache and nausea or vomiting, and there are systemic effects as well. So there is so that's about the hemorrhagic stroke, and then there are different symptoms depending on the localization. Can be lobar, then you have seizures, can be basal ganglia, then you have more like hemiplegia. It might be a little bit too much going into details here, but you can read it. I just give you an overview. It can be the thalamus can be affected, and you can be in the pons, cerebellum. This is all the regions where a hemorrhagic stroke can occur. And what we had here in our case, that was a big problem with communication. And we know that 1 in 3 stroke survivors experience difficulties with communication. And the main condition that because communication problems occur, they have aphasia, dysarthria or dyspraxia, and cognitive impairment, of course. So they are 33% of the survivors have really
communication difficulties. Thomas, can you go back to a slide, please, just for 1 second? Because I want to point something out that is it's important to me. One more, please. So when you have, this is the thing that you wanted to describe. You can have a hemorrhagic stroke, which is a blood coming in. That's
yes.
Versus an ischemic stroke, which is blood being taken away.
Yes,
right.
Of course. Yeah,
I heard you make that, but I wanted to clarify. Now, that blood can be inside the brain, which, destroys brain tissue, or it can be outside the brain in the dura and create pressure that way. So right. I kind of missed that point, but Right. The funny thing is that, I said my mother had a subarachnoid hemorrhage, and she developed aphasia, and she got better after I treated her with her brain. I just want to put that in there. But, it's different than the intracerebral stroke that you described earlier. So thank you for putting this up there, because
and thank you for giving more details on it. Of course, yeah, it's a brain to the brain. Yes,
this is what my brother showed me. The triad of a subdural hematoma or subdural hemorrhage is aphasia, incontinence, and one more thing. I think probably, but apraxia probably also, the things that you pointed out. So thank you for clarifying that. Go ahead.
Yeah. Okay, and a really severe problem that comes up with those strokes is when people cannot communicate and they have aphasia. Don't know how you say it. Aphasia, right?
Well, we could say aphasia, but then the British are going to change it and call it whatever they want. The aphasia, aphasia, that's the British.
Right, and so this can affect talking, all these speech abilities, language abilities, reading, writing, and we had all these problems in our patient. Also, dysarthria can happen, problems moving the tongue and the lips, and all these coordination to produce speech and language. Also, they can have dyspraxia of speech, and they have no opportunity to move the muscles in the right way. And it's all about coordination. It's a very complicated process actually to speak and to have language. And also there is a loss of certain mental functions we can see, including cognitive functions like memory, learning, and attention as well. When we look at the statistics, that might be interesting that there are a lot of people can be affected by a stroke. WHO says 50 million people suffer from a stroke worldwide each year, and this is for both, of course, hemorrhagic and ischemic strokes. And about 5 million people die, and another 5 million are permanently disabled. So there is a huge amount of people who have problems after the stroke event, and it really impacts the quality of life in a very severe way. So, and the statistic says that the less developed the country is, the more stroke deaths they have, and one of the biggest reasons why why a stroke can come up is because of high blood pressure, and this it contributes to more than 12.7 million strokes worldwide. So, what's a big problem is 70% of all strokes occur in low and middle income countries. Well, and the annual number of stroke events in the European Union, there is a statistic that says they will increase. We have a lot more people with strokes, and of course, we have to consider that this is a population that is in need of health care, and it will cost a lot of money for the healthcare system to take care of these, not just the healthcare system, the state in general, because these people cannot work anymore. They have a lot of impairments, so they cannot.
And look at that, Germany's number one. Thomas, Germany's number one there. You don't. That's not what you want to be number one in.
That's crazy. I was really also shocked when I saw that. Well, but that's what the statistics says, and hopefully that can change.
These are the aging populations. These are the ones that have the oldest populations. These top 6, top 10, right?
That will be in 2035 if it goes on like this. So really, something needs to change, because that is a huge problem. Of course, the population gets older. There are many reasons why, because of that, but many times it's probably a lifestyle problem. Because the high blood pressure is a typical disease of civilized countries as well. Well, and here we see that there is even strokes in babies can happen. 1 in 4,000 babies have a stroke at birth worldwide, as the statistics say, and 55% is hemorrhagic stroke. So there's a huge amount of number that will have problems. And
one thing, Thomas, is an intrauterine stroke, I believe, is referred to as cerebral palsy. So it always gets a little confusing as to, they don't call it the child had a stroke, they call it cerebral palsy. And that's a neurologic deficit in babies and children. That's a good point, though.
Yeah. Even very young people can get this, can have caused by even so they never did something wrong, and you cannot. How can you put the cause on this? Yeah, it's very difficult. But anyway, there is a big number of people who have problems because of bleeding or ischemic strokes. All right, so let's talk about our case study, which is a woman in when she was she had an hemorrhagic stroke, and it was really a very severe thing. And let me show you the MRI picture. And it was in April 2017. We see clearly that the white regions is depleting, and so it was affecting mostly the language areas. And the problem was here, she has been not in hospital immediately after the stroke. She was there for 2 days more before she got into hospital, because doctor said this is no problem. It will go away. Her problems. She was caught, and it was really a big problem. So okay. Anyway, so. Well, usually when this happens and you have an aphasia after stroke, there is sometimes a spontaneous recovery, but only if it's a mild case with like a transient ischemic attack called a TIA. And it's a kind of stroke in which the blood flow in the brain and is temporarily interrupted but quickly restored by the brain again. And in these circumstances, language may return in a few hours or a few days even. For most cases of aphasia, however, the language recovery is not as quick as complete, and it's almost never complete. And just to explain that we had a really severe case here. All right, and so with our patient, and this was home treatment, we only saw her 2 times. When we did the EEGs, the QEEGs on her. So I was the symptoms when we saw her: confusion, no understanding of words and cues, no recognizing persons on the phone. She didn't know who's speaking. Even her daughter, she couldn't figure out who it is. She had no sensory impairment, but there were headaches. And aphasia, of course, and psychomotoric agitated was only light, but she was not. She was like really excited, and she was crying because she was discovering that she couldn't read anymore. And she was a teacher, and she loved to read books, and writing also wasn't possible. She was also bilingual. And what was done, partially we did, and we tried neurofeedback, home training with her, but that really was too difficult. Nobody could put the electrodes on her. She was mostly alone, and it was really difficult to do neurofeedback. So we decided to send a device of the V-Light Alpha to her on the May of 19th. With speech therapy, there really was not much improvement. Well, that went every day, 20 minutes. She did the alpha, and the speech therapy was continued. And by the end of June, we've seen really some improvements. And in July, there was just a very big change from day to day and a huge progress in writing, reading, and speaking. And we really saw that there was such a great improvement also in life quality, and also the second language came back slowly. The mood changed more and more to a positive mood, and the patient was even able to work partially some hours a day. She did some homework
in just a few short months.
Yeah, it was not long. It was not long. The neurologist said, when he saw her and we had consultations, he said probably from what the picture says, the MRI says, probably she may never be able to speak again. And only a small progress we can expect, so that she will be able to speak again or reading. To that amount, what happened will be not possible.
But remember, this is also the neurologist that sent her home saying it'll pass. It's all going to get better. So first they told her it's going to be better, and then they tell her she's never going to get better.
Yeah.
Let's not listen to them.
Yeah. It's really very strange as well. Anyway, but we'll see. In April, the EEG, and then in July, we did another EEG. She was way better in July. still we have, we are looking at 6 standard deviations of delta, which was even more, because you cannot see all the red means, the red number, the red color means it's 6 standard deviation of delta excess. And in July we did another one. We still have about some 2, sometimes 3, 2.5 standard deviations of delta and theta, but we see a lot of improvement in the EEG, and well, the coherence went a little less, but the high the coherence with high beta also went better. So, but it went down to low coherence. This is probably the case when we see recoveries. High coherence changes to low coherence, and then we see a normalization after time.
Thank you for that.
Well, yes, and this is the raw EEG, how it looked like soon left side, soon after the stroke event. There was so much low high delta, so it was. I thought it's all artifact, and everywhere, not just on the region where we saw the insult or the hemorrhagic event. It was all over the place, and so and the last EEG we did in July, it looked much more in order. This is eyes closed, and we see even some rhythm here. And when we look at the spectrum in April, there was there was with eyes closed hardly any alpha to be seen, and we had a very high amplitude and in delta. But here in July 2017, we all of a sudden we see alpha again. So there is a peak frequency, and that's the end of the presentation.
So
we have seen huge progress in this
Go back one, please. So you know about this stuff quite a bit more than I, but you gave her the Violite Alpha, which has a frequency of light at 10 hertz.
Yes.
And you saw the alpha power and the peak frequency at alpha increase.
Yes, of course. Look, this is hardly that. This is about 8. Yeah,
right.
This is about 8, and then we have here. We still don't have 10, but we have about 9, which is kind of normal in this case.
Right. So you think that you were driving alpha with your transcranial photobiomodulation? Is that what you were doing?
Sure. Yes. I think this really, this is also our experience from other cases, that the alpha peak frequency normalizes. Yeah, it really drives alpha peak frequency. That's my this is what I really see. Yeah.
So that's pretty good evidence that that you are rehabilitating the brain on the inside. You're allowing the brain to resonate at a frequency of light that you're putting in. Is that how you interpret it?
Yeah. And this is only happening with the alpha. Now, if we can even put EEG guided stimulation to it, like what Penigene does, we probably see even more progress in what we do. So that would be, I'm very excited about Penigene's talk, and thank you very much for your attention.
Thank you. Go to the next slide, because you're the head of brain research unit at the Evoke Response Potential Lab there.
Yes,
and you're doing a lot of work with the interpretation of these findings. Which is a little bit more advanced than just looking at the brain. It's giving it a task and everything. So we look forward to that presentation when you give me the data on that.
Me too. Thank you very much. Yes. We'll show this. Yeah. We're constantly working on the evoked potentials for also for neurofeedback and of course other treatments.
Hello and welcome to the Brain and Transcranial Photobiomodulation Virtual Summit. I'm Dr. Joe Doduro, your host, and my guest now is Dr. Dan Johnstone. Johnstone? Better do that again. Dan Johnstone, right?
Yeah, Johnston is fine. Yeah,
Johnston is okay?
Yeah, that's right.
I think I've heard it before.
That weird Scottish spelling.
Which would you prefer, Dan?
Dan Johnston, that's good.
Johnston. All right.
Yeah.
All right, then. And then 3, 2, 1. I'll cut this out. Hello and welcome to the Brain and Transcranial Photobiomodulation Virtual Summit. I'm Dr. Joe Doduro, your host. Wonderful. This is going great. Damn coronavirus, you got me. I haven't. Well, at least I hit the record button. It's all good.
Yeah, that's good stuff.
All right.